Today, we're diving into the absolutely wild story of how India played the long game to become the pharmacy of the world, supplying affordable medicine to billions of people. Okay, let's just jump right in. Look at this. On the left, you've got a life-saving cancer drug called Nexavar. Its price, a staggering 280,000 rupees per month. On the right, the exact same medicine, made in India for just 8,800 rupees. So how on earth is that even possible? Yeah, you saw that right. That is a 97% discount. A price drop so huge, it literally means the difference between life and death for millions. But here's the kicker, the part that'll really blow your mind. All of this, it was done completely and totally legally. And when Bayer's CEO was asked about that eye-watering price, this was the response. It's pretty blunt, right? It just lays bare the fundamental conflict at the heart of this whole story. The profits from innovation versus the right to affordable healthcare. So that's the big question, isn't it? How did India pull off this pharmaceutical masterstroke? And I want to be super clear here. This wasn't some kind of black market deal or patent theft. Nope. It was all thanks to a series of incredibly clever and perfectly legal moves. All right, to really get this, we've got to rewind the clock, way back to 1970. This is where the foundation for everything was laid, with a single, game-changing law. India's brand new Patents Act. Okay, this part is super important. In the West, they use something called a product patent. Think of it like this. If you invent a unique cake, you patent the cake itself. Nobody else can make or sell that cake for 20 years. But India did something genius. For medicines, they adopted process patents. This meant you couldn't patent the cake itself, only your specific recipe for making it. So if another company figured out a totally different recipe to make the exact same cake, well, that was fair game. And the result of this one little change was explosive. Indian companies like Cipla became absolute masters of reverse engineering. They'd take these expensive Western drugs, figure out a new way to make them, and then sell them for a tiny fraction of the cost. The most famous example, of course, was the HIV/AIDS cocktail. The price plummeted from an impossible $12,000 a year to less than $350. We're talking about a move that saved millions and millions of lives, especially across Africa. But this golden era couldn't last forever. As India's economy opened up, it joined the World Trade Organization, and suddenly the pressure was on big time. The world started telling India, you have to play by our rules now, and that meant adopting those Western-style product patents, a move that could have killed its entire generic industry overnight. So you can see the pressure building right here. India joins the WTO in '95 and boom, the clock starts ticking. The deadline is 2005. They have to switch to product patents. And you can bet the big Western pharma companies were thinking, game over, we won. But India had another ace up its sleeve. First, you need to understand this sneaky tactic called evergreening. Imagine a company's 20-year patent on a blockbuster drug is about to expire. Right before it does, they make a tiny, meaningless change, like, say, changing the pill's coding, and then file for a brand new 20-year patent. It's a way to keep their monopoly going forever and block cheaper generics from ever hitting the market. So, how did India fight back? With this brilliant little piece of law called Section 3D. When they updated their Patent Act in 2005, they slipped this in. It basically said, look, you can't just change the flavor and get a new patent. If you want a new 20-year monopoly, you have to prove your new version is significantly better for patients. In other words, they slammed the door shut on evergreening. And boy, did this get put to the test. The Swiss pharma giant Novartis took India all the way to its Supreme Court in 2013. They wanted to patent a slightly tweaked version of their massive cancer drug Gleevec. But India's Supreme Court, citing Section 3D, said, nope, not good enough. They denied the patent. It was this huge landmark victory for patients, not just in India, but all over the world. So India had these two amazing defenses. But what about a brand new, patented drug that's just so expensive nobody can afford it? Well, for those extreme cases, India had a third and perhaps its most powerful tool, something called the compulsory license. So here's how it works. The government can basically say, okay, that patent is temporarily suspended and allow a local company to make a generic version if these three specific conditions are met. It's like a nuclear option for public health, but one they can only use under very strict, justifiable rules. And this is what brings us right back to that first slide. This is exactly what happened with Nexavar. The government looked at the situation and said, okay, This drug is clearly not reasonably affordable for our people. And so they issued their very first compulsory license to an Indian company. The result? That 97% price drop. Absolutely incredible. So you have these three pillars, right? The process patent, the anti-evergreening law, and the compulsory license. This three-pronged strategy didn't just transform healthcare in India. It's the reason India became the pharmacy for the entire world. I mean, just look at these numbers. Take vaccines. 60%, that's 60, of all vaccines used globally come from India. Think about that for a second. The scale is just mind-boggling. And it's so much more than vaccines. If you're in Africa, there's a 50-50 chance your generic medicine came from India. In the US, 40% of your generics. The UK, a full quarter. By sheer volume, we're talking about the third largest producer of pharmaceuticals on the planet. But the story doesn't end there. Behind all of this incredible success, there is a hidden weakness, a major vulnerability that could threaten this whole amazing system. To get it, we need to talk about something called APIs, active pharmaceutical ingredients. It sounds complicated, but it's pretty simple. It's the main active stuff in any medicine, the magic ingredient, if you will. You cannot make a pill without the API, and that's where the problem is. This chart tells a crucial story. You see, India's exports of finished medicines going up and up, which is great. But look at that other line. That's India's imports of APIs from China, and it's rising even faster. To put it bluntly, India might be the one putting the pills in the bottle, but it's China that's supplying the key ingredients. And this isn't a small dependency. We're talking about essential, everyday medicines. Paracetamol, penicillin. India imports more than 90% of the raw materials for these from China. Think about the implications. If anything were to disrupt that supply chain, the pharmacy of the world could, quite literally, run out of medicine. Now, the Indian government isn't blind to this. They know it's a huge risk. That's why they've launched this massive, multi-billion-dollar plan to essentially bring API manufacturing back home. The goal is to become self-reliant again and secure its own supply chain. So when you look at the whole story, it's this incredible chess match of legal strategy, all in the name of public health. Now, if you're a CEO of a big pharma company, you might see all this as cheating the system. But if you're a patient who can suddenly afford a life-saving drug, it's a lifeline. And it leaves all of us with one big, profound question to think about. What really is the point of inventing these amazing cures if the very people they're meant to save can never, ever afford them?